I'm Dr. John Allen, and today we're going to talk about taking vital signs. At the beginning of every physical exam, whether it's a focused exam or a thorough exam, vital signs are a key component. Many times in the clinic or even in an emergency room, your nurse will get most of the vital signs, but it is your obligation to know how to check the blood pressure, pulse, and respirations because you will be doing that a lot yourself. So we'll start out right before that. We want to look and see how comfortable our patient is, and you can see that he's very comfortable, no acute distress. The next thing we want to do is take the blood pressure. Blood pressure is taken with a cuff on the arm, and there's various sizes of cuff depending on the patient's arm. You can have a large adult cuff, which is a number 12. You can have the most commonly used one, which is a regular adult cuff, which is 11, and the small adult cuff is a 10. I just happen to have what I think is a 9. It's a child cuff. So you need to make sure that the cuff fits the patient's arm. And a good way to assess that is by looking at the bladder inside the cuff. And the bladder itself should go about 80% around the circumference of the patient's arm. You don't want the bladder to overlap itself. You want about 80% of it to overlap the arm. And the bladder is not the whole length of the cuff. The bladder is where the air is pumped in, and you can see the edges of the bladder here. And on measuring our patient here, we know it's about 80%, so this one will work for him. So we'll first put on the blood pressure cuff. Make sure that the index marker for the artery is above the brachial artery, and you want it about 2 to 3 centimeters above the antecubital space. You want to get it on snug, so tighten it up so the Velcro is sealed well. Then the first thing I want to do is check his pulse to make sure I know how high to pump up the blood pressure. So the first thing we'll do is, with his arm at heart level, I'll pump up the blood pressure cuff, and I'll make note of the point where his blood pressure is obliterated so I don't get a pulse. When I pump it up, I lose the blood pressure pulse at about 138 there. And letting it back down, the pulse came back at about 126. What I want to do is make sure that the blood pressure is taken and pumped above about 20 centimeters above the pulse that I felt it disappear at. So again, with the patient sitting, back resting against the back of the chair, feet flat on the ground, and with his arm at heart level, being supported either on a table or by the examiner, I'm going to take the blood pressure. So I have a hold there. So I'm holding his arm. I'll support it with my right arm. And I'll pump it up slowly until I get to 160, because that's about 20 above where it was lost the pulse before. Slowly let it down. And I got 128/70 that time, so that's a normal blood pressure. Second thing is we want to check the other side. So when you have never seen the patient before and you don't know that he doesn't have a blood pressure discrepancy, always important to check it on both sides. So first check your pulse here. It's about 130, and I felt it go away and come back again. So now we'll check the blood pressure, supporting your arm at that level. You can just relax it in my arm there. Actually heard it at 134/68. So the next thing you want to do is check the pulse and the respirations. And you can do this at the same time. You want to check his radial pulse. Later in the exam, you'll be checking both pulses for pulse quality. So I'm only going to check his pulse for measuring the rate on one radial artery. At the same time, I'll be watching his respirations and counting those. On the wall above the patient is a clock with a second hand, and I'll use that second hand to time my pulse and respirations. I will usually take the pulse and count the respirations for anywhere from 15 to 30 seconds. If I do it for 15 seconds, I'll multiply it times 4. If 30 seconds, I'll multiply it times 2. So next we'll check your pulse here. You can just rest and breathe normally there. Okay, got your pulse to be about 78, and I'm guessing your respiration is about 16. So that concludes the vital signs that we're able to take. Again, our nurse will probably check the temperature, and it's usually by an ear probe or a forehead probe. They'll check the oxygen saturations, which is a monitor that they can put on a fingertip and measure that. Very simple to do. They'll check the patient's weight, and they'll calculate the BMI based on his other vital statistics.